The scariest thing about heart failure is that it doesn't arrive loudly. It comes quietly, silently, little by little. And you may be experiencing the very first signs right now, without even realizing it. Do you feel slightly short of breath when climbing stairs? Need extra pillows to sleep comfortably? Or have you been more tired than usual lately? You assume it's just aging, stress, lack of sleep. But what if it isn't? More than 6 million people are living with heart failure, and most only discover it once the condition has become serious. Your body always sends warning signals before a major event happens. The question is, are you recognizing them? In this video, you'll discover 13 early signs of heart failure that most people ignore every single day. One of them happens when you bend down to tie your shoes. Another appears in the middle of the night when you suddenly wake up gasping for air. By the end of this video, you'll know exactly what's normal and what could be threatening your heart. Let's begin. Are your hands and feet constantly cold? Even in warm rooms? Pay attention to this. You're in a warm room. Everyone else feels fine. But your hands are cold. Your feet are cold. Not mildly cool, but deeply, persistently cold. Sometimes your fingernails look pale or slightly bluish. Sometimes your lips appear less pink than usual. You assume it's poor circulation, or that you just run cold, or the air conditioning. But what if it's not that simple? When the heart isn't pumping forcefully enough, the body prioritizes blood flow to vital organs like the brain and heart. And what gets reduced? Blood flow to the extremities. Less blood, less oxygen, less warmth. That's why your hands and feet feel cold, even when the temperature around you isn't. There's an even subtler sign, a narrowed pulse pressure. Normally, the difference between systolic and diastolic blood pressure is about 40 millimeters of mercury or more. When that gap becomes significantly smaller, it can indicate reduced stroke volume, meaning your heart isn't pumping enough blood with each beat. In other words, cardiac output may be declining. What makes this concerning is how gradually it develops. You get used to cold hands. You assume it's just your normal physiology. But if persistent cold extremities occur alongside fatigue, dizziness, or shortness of breath, your circulatory system may be under strain. And when circulation is compromised, your heart may be approaching its limit. Do you get short of breath within 30 seconds of bending forward? Try this. Bend down, like you're tying your shoes, picking something up off the floor, or leaning over a sink. Now pay attention. Within 30 seconds, do you feel short of breath? If you do, that's not random. This symptom has a very specific name, bendopnea. First described in medical literature in 2014, cardiologists consider it a significant indicator of elevated heart pressures in heart failure patients. When you bend forward, pressure inside your abdomen increases. That pressure pushes up against your diaphragm. It raises pressure inside your chest cavity. A healthy heart can adapt, but if your heart already has elevated filling pressures, even a small positional change can trigger breathlessness. And here's what makes it concerning. Healthy individuals rarely experience this. Studies show bendopnea is strongly associated with increased cardiac filling pressures and more advanced disease severity. This is not a vague symptom. It's specific, observable, and testable at home. If bending forward quickly leaves you gasping for air, your heart may already be under significant strain. And that is a warning you should not ignore. Feeling full. After just a few bites? This one might surprise you. You think heart failure only affects your chest and breathing? What if the warning signs start in your stomach? You take a few bites of food, and you're already full. Not comfortably full, but bloated, heavy, uncomfortable. Maybe with mild nausea, loss of appetite, or a pressure-like sensation in the upper right abdomen. You assume it's indigestion. A sensitive stomach. Irregular eating habits. But when the heart can't pump efficiently, blood can back up into the liver and digestive system. The liver becomes congested. Fluid can accumulate in the abdomen. The gastrointestinal tract receives less oxygen-rich blood. And suddenly, you feel full much faster than normal. What makes this symptom dangerous is that it doesn't feel cardiac. It misleads you. You try antacids. You change your diet. Meanwhile, the real issue may be circulatory. Research shows gastrointestinal symptoms are frequently overlooked in early heart failure patients. But if persistent bloating, early fullness, and loss of appetite continue, especially alongside swelling or fatigue, don't just blame your stomach. Your heart may be involved. Have you ever stood up and everything went dark? You stand up from a chair, and within seconds, the room starts spinning. Your vision blurs. There's a faint ringing in your ears. Your legs feel weak, like they might give out. You grab the wall, or sit back down immediately. A few seconds later, it passes. You tell yourself, it's just low blood pressure. I'm probably dehydrated. I stood up too fast. But what if it's not that simple? When the heart isn't pumping strongly enough, the brain may not receive adequate blood flow during sudden position changes. A healthy heart instantly adjusts heart rate and blood vessel tone. A weakened heart may fail to respond quickly. The result is a temporary drop in blood flow to the brain. You feel dizzy, lightheaded. In some cases, you may even faint. Clinical studies show that syncope, or near syncope, can be a warning sign of reduced cardiac output. The danger lies in how easily it's dismissed. But if you frequently feel dizzy when standing, or have episodes where you nearly lose consciousness, especially alongside palpitations or shortness of breath, your heart may be struggling to maintain stable circulation. And that is not a minor symptom. Is your heart beating irregularly, even at rest? Have you ever been lying still, doing absolutely nothing, yet you can feel your heart pounding? Faster than normal, out of rhythm. Almost like it's flipping inside your chest. Sometimes it skips, sometimes it races uncontrollably. And you reassure yourself, it's just anxiety. Too much caffeine. I didn't sleep well. But what if it's more than that? When the heart begins to weaken, it works harder to compensate for reduced pumping efficiency. That extra strain can trigger abnormal heart rhythms, especially atrial fibrillation, a condition that can both cause heart failure and be triggered by it. It becomes a dangerous cycle. The heart beats faster to compensate. But beating faster can weaken it further. Cardiology research shows that arrhythmias commonly coexist with heart failure and can rapidly worsen outcomes if left untreated. What makes this symptom unsettling is that it's often most noticeable at rest. When everything around you is quiet, you suddenly become aware of your heartbeat. If your heart frequently feels irregular, especially alongside shortness of breath, fatigue, or dizziness, don't ignore it. It may be your body's internal alarm system activating. A cough that only happens when you lie down. Have you ever laid down to sleep and within minutes the coughing starts? Not a cold, not thick mucus, but a persistent, dry, irritating cough. During the day, you're mostly fine. But the moment you lie flat, it begins. You blame allergies, the air conditioning, dry air. But what if the issue isn't your throat, but your lungs? When you lie flat, fluid in your body can shift toward your chest. If your heart isn't pumping efficiently, some of that fluid can leak into your lungs. Your body responds by triggering a cough. Sometimes there's a slight wheeze. Occasionally, a small amount of white or even pink-tinged frothy mucus. That's not typical mucus. It may be fluid accumulating in the lungs. Cardiology literature describes this as a common symptom in heart failure patients, especially at night or in the early morning hours. What makes it dangerous is how easily it's dismissed. But if your cough appears when you lie down and improves when you sit up, that's not a coincidence. It may be a sign your lungs are under pressure because your heart isn't pumping effectively. Are you waking up multiple times a night to urinate? Be honest. Are you getting up 2, 3, maybe even 4 times a night to use the bathroom? You assume it's because you drank too much water, or because you're getting older, or that it's just normal. But what if it isn't? During the day, when you're upright, Gravity causes fluid to collect in your legs. If your heart isn't pumping efficiently, that fluid doesn't circulate properly. It stays there. When you lie down at night, gravity no longer pulls fluid downward. The fluid redistributes back into your bloodstream. Your kidneys suddenly receive an increased volume of fluid and go into overdrive. The result? You wake up repeatedly to urinate, often with larger amounts than usual. Cardiology research shows that frequent nighttime urination, known as nocturia, can be one of the earliest signs of heart failure, sometimes appearing before noticeable shortness of breath or visible swelling. The problem is how easy it is to dismiss. You simply think, I must have had too much water. But if nighttime bathroom trips are becoming more frequent than they used to be, your heart may not be managing fluid effectively during the day. And sometimes, the earliest warning signs hide inside ordinary routines. If the scale is climbing fast, don't ignore it. Imagine stepping on the scale in the morning, and you're up 2 pounds. You'd tell yourself, maybe I ate too much salt. The next day, it's higher again. Within a few days, you're up 5, maybe even 6 pounds. But you haven't been overeating, you haven't changed your diet. So what's happening? It may not be fat. It may be fluid. According to the American Heart Association, gaining 2 to 3 pounds in 24 hours, or 5 or more pounds in a week, is a reason to call your healthcare provider immediately. When the heart weakens, the body activates hormonal responses that cause the kidneys to retain salt and water. Instead of eliminating fluid, your body holds on to it. Each kilogram of weight gain can represent nearly 1 litre of excess fluid. And here's what makes it dangerous. This rapid weight gain often happens before obvious swelling or severe shortness of breath appears. The scale starts climbing before the symptoms feel dramatic. Consistent, unexplained upward weight gain is not a normal fluctuation. It may be a warning that your heart is struggling to manage fluid properly. If your weight is rising quickly over just a few days, don't just blame your diet. Consider your heart. Are your legs quietly holding fluid? Look down at your feet. Are your ankles more swollen than usual? Do your shoes feel tighter by the end of the day? Are your socks leaving deep marks in your skin? If so, don't immediately blame it on sitting too long. Leg swelling is not always harmless. When the heart begins to weaken, it can't pump blood efficiently. Blood starts to pool in the lowest parts of the body, your legs. At the same time, your kidneys receive less blood flow. They mistakenly think your body is dehydrated. So they hold on to salt and water. The result? Fluid leaks into surrounding tissues. Your legs begin to swell, slowly. At first, your shoes just feel a little tight. Then your ankles appear puffy. Eventually, the swelling can move up your calves. If you press your finger into the swollen area and it leaves a dent that takes several seconds to disappear, that's called pitting edema. Cardiology research shows this is one of the most common early signs of heart failure. What makes it dangerous is how gradual it is. You get used to the tight shoes. You get used to the heavy feeling at night. But your body isn't storing fat. It's storing fluid, and that may be a sign your heart is struggling. When simple tasks start feeling exhausting. Have you felt like your body just isn't what it used to be? Not the kind of tired you feel after a long day, but the kind where you sleep all night and still wake up exhausted. You shower and need to sit down afterward. You carry a few grocery bags and have to stop halfway. You begin avoiding stairs, avoiding longer walks, avoiding activities that once felt normal. And you tell yourself, I'm just getting older. I probably didn't sleep well. Maybe it's just stress. But what if it's not laziness and not aging? When the heart can't pump efficiently, the body prioritizes blood flow to vital organs like the brain and heart. Your muscles receive less oxygen, less energy, less fuel. The result is persistent, unexplained fatigue. Studies show this symptom can appear months before heart failure is officially diagnosed. What makes it dangerous is how gradual it is. You don't notice your stamina fading. You simply adapt to it. But if activities that once energized you now leave you drained, your heart may be struggling to keep up. And that is not normal. Have you ever woken up in the middle of the night, gasping for air? Picture this. You're in a deep sleep. Suddenly, you jolt awake. Your heart is pounding. Your chest feels heavy. You try to breathe, but the air doesn't feel like enough. You have to sit up, maybe even rush to a window for fresh air. A few minutes later, you convince yourself it was just a nightmare. Maybe anxiety. The room was probably stuffy. But what if it wasn't? This symptom is called paroxysmal nocturnal dyspnea. It typically happens 2 to 4 hours after falling asleep. Here's why. When you lie down for several hours, fluid that has accumulated in your legs during the day redistributes back into your circulation. A weakened heart cannot handle this sudden increase in fluid. Fluid backs up into the lungs, and you wake up gasping. Cardiology research identifies this as a serious warning sign of worsening heart failure. What makes it dangerous is how often people misinterpret it as panic attacks, sleep apnea, or simply a bad dream. But if you are repeatedly waking up at night, struggling to breathe, your heart may be under strain. And that is not something to ignore. Needing more pillows to sleep? This is not just a comfort issue. If you used to sleep flat comfortably, but recently you added 1 pillow, then 2, then 3, and now you can only sleep propped up, that is not just a preference. Your body isn't asking for extra comfort. Your heart may be struggling when you lie down. When you lie flat, blood from your legs and lower body returns back to your heart. A healthy heart handles this effortlessly. But when the heart is weakened, blood backs up into the lungs. Fluid begins to accumulate, and suddenly, breathing becomes difficult. According to the American Heart Association, this condition, called orthopnea, is present in a large percentage of heart failure patients. What makes it dangerous is how gradually it develops. You don't notice the change. You simply think, sleeping higher feels more comfortable. But if you can no longer sleep flat without feeling breathless, your heart may be sending you a warning. Shortness of breath during very ordinary activities. If you have to stop to catch your breath after climbing a single flight of stairs, that is not a small thing. If walking outside to get the mail leaves you breathless, that is not just being slightly out of shape. And if tasks that used to feel easy now force you to pause halfway through, your heart may be having a problem. We're not talking about being winded after an intense gym workout. We're talking about everyday activities, things you were able to do comfortably just a few months ago. According to the American Heart Association, shortness of breath with mild exertion is one of the earliest and most common signs of heart failure. So what is actually happening? Your heart is no longer pumping enough oxygen-rich blood to meet your body's demands. When your muscles don't receive enough oxygen, your lungs have to work harder. The result? You feel breathless. The most dangerous part is this. This symptom progresses very slowly. You won't notice it right away. You'll just think you're a little tired, a little weaker, a little older. But heart failure does not appear overnight. It begins with small changes like this. If you notice your endurance gradually declining over time, don't ignore it. If you recognized yourself in any of these signs, don't panic. But don't dismiss them too quickly either. Heart failure rarely appears overnight. It develops quietly. Small changes, mild symptoms, moments where you tell yourself, it's probably nothing. The issue isn't one isolated symptom. It's the pattern. Mild shortness of breath, persistent fatigue, swelling, waking up at night, irregular heartbeats. When these begin appearing together, it's no longer a coincidence. Here's the good news. When caught early, heart failure can be managed. Modern medicine offers medications, therapies, and lifestyle changes that can slow, and in some cases significantly improve, the progression of the disease. But only if you pay attention. Don't wait for an emergency room visit to take action. If these symptoms feel familiar, talk to your healthcare provider. A simple evaluation could give you answers, and it might protect your heart. If this video helped you recognize something important, type OK in the comments. Share this with someone you care about. It could help them recognize an early warning sign. And subscribe for more health content designed to keep your heart strong.